So what we're doing here is, so it's Radius Classic, it's not Radius Plus. You can use Radius Plus and you'll be fine. It's not a safety issue, it's just, this is great, Radius Plus is good. And it's just, this is a slightly higher G prime. The goal of this intervention is an athletic look. It's not that Brazilian butt lift,
Right.
just we don't want that ass.
Yeah.
We want that ass.
Yeah, the good one.
Yeah.
Not the oh.
Yeah. we want the J-Lo, not the double K.
Yes.
So what the dilution is the what works best for us is 1 to 3.
Okay.
So if we traditionally will start, now I'm guesstimating. So the highest I go would be 10 tubes per cheek
Okay.
per side at one setting.
In one setting, 10. Wow. Okay. Cool.
So, and it's very common to touch that up with another 5.
Okay.
Okay? And I'll show you some before and after in just a second.
Awesome.
So what Alyssa is doing is she is getting carpal tunnel syndrome right now, right now as we speak. But she's taking 10 of these 1.5s and putting them in, and what we usually do is we'll make 2 big,
Yeah.
Like-
so that
like
you're not
60.
like each one each time.
and then we'll break that up into 3. So you go 3 cc's of 20. So how many do you have in so far?
That's 10.
We're like
Okay.
one and then
That's
one.
10 tubes of.
10 tubes, and then we're going to jack and jill this back and forth.
All right.
Another 60 cc's. When you're setting up for using this, you want to try to use Radius instead of Radius Plus. Okay, you get a higher G prime. Okay, the goal of this is an athletic look. What you're going to do is you're going to dilute this 1 to 3. Okay, you can use lidocaine if you want, but that's a lot of lidocaine. Okay, because you're doing it on both sides. We use saline. It should look something like this. Okay, so this is 10 tubes of Radius, which is 15 cc's of calcium hydroxyapatite mixed with 45 cc's of saline to give you a total of 60 cc's. Then you're going to jack and jill it back and forth, and you're going to make yourself your slurry. You're going to see it's going to take a little time, but you're going to turn all of that into a nice white powder. See how it's coming? And then there's different ways to do this. It doesn't really matter. Find what you're most comfortable with. We'll end up with 2 tubes of 30 cc's, okay? But you cannot mix this too much. You can only mix it too little, okay? You can't mix this too much. So the more you dilute this, the better you're gonna do. What you have here is a very high-hipped, well-structured woman, and it's beautiful, okay? So this is the upper line of the buttock, okay? This here is hip, okay? So when you look, you can see this length here. It's tantalizing to say maybe we should treat this. You don't want to. You want to treat from the top of the gluteus to the gluteal cleft. And then you'll see they'll come in a straight line. The straight line between the gluteal cleft and this line comes when the concavity, see how there's a curvature in there? And it stops right there. That's your end point. This to right there, to what we call the credit card swiper, that is what you're treating. This is your area. Now, she has much more projection down here than she does up here. We're using a filler that lifts. So if we target this area here, and this concavity there, we will create this effect. And that is the end point. That's what we want to do. Now, different women have different structures. So if you're coming in, one of the last ones, actually one of the ones I showed you before was a woman who's a professional fitness model, okay? So with her, she has a lot more muscle here. I put very little here, but she has very little body fat. So she had just a big divot here. So 70% went here. In this scenario, there's less of a concavity here, but we want to augment this because that's going to pop. That's going to pop. That's going to look good. So same thing here, okay? So top of the gluteal, top of the gluteus, gluteal cleft, and then have those 2 lines meet where the convexity or the concavity stops, which is right about there. And then we want to do that shelf there. Hey, this pen is awesome. And then you see as well, she has more of a concavity on this side than this side. So we're gonna put right there, and then just a little right there. You saw it. Good.
That'll create the lift you're looking for.
And a nice.
Start here, second here, third there. Of all three, this is the most important. That's where you're gonna get their lift from. Now, you're not injecting this into the muscle. That's where you're into trouble. You're injecting in the sub-Q plane and the deeper sub-Q plane. So if you inject and you see somebody twitch, they'll twitch. Just pull back. That's it. With the needle that we're using or the cannula that we're using, you're not in terrible danger. But there's no reason to risk it. And there are repercussions, especially from the Florida Board of Medicine, to doing intramuscular injections.
Yeah.
Sounds
And
like
we don't need to know what those feel like.
super uncomfortable anyways.
Good. All right. Let's get started.
How long does it last? And you said
Minimum
2 years?
15 months, upwards of 2 years.
Upwards 2 years, and then.
Same as your cheeks.
Does she need to come back after?
So we do recommend touching up.
Okay.
We do, and I'd be shocked if Brent said no, but I'll find out. But usually we'll do 10 tubes per cheek today, and then we'll come back and we'll do another 5. That's usually what we do, but
And then after the 2 years, when she comes back, does she need the same amount?
so they're just starting to come back. Okay, so to be full disclosure, so I've had 2 people come back.
Yeah.
One we redid, but we redid it 50%. The other one still had it.
Wow.
Yeah, and we just did a little bit more.
Yeah.
Like, you know what I mean? So I'm gonna know a better answer
that's
for that
fair.
probably at the end of 2021.
That's fair.
Fantastic question though.
My radius has lasted almost 3 years.
That's what I'm saying. Like, so we had that young lady that prepaid today. Yeah. She's 14 months out. There is zero reduction.
Reduction after.
Zero. None.
Yeah.
None. Now she comes back every 8 months for an HA.
Right. Very cool. Good answer.
Okay. Now, are you guys cannula people or are you needle people?
Both.
Okay. I would recommend for this. This is a little viscous. Okay. So I think what you want to do is I would probably, when you're starting, use a needle. Okay. We use TSK cannulas for this. Full disclosure. Yeah. That's the
For
only
the
one.
butt, so far we've used cannulas.
Yeah. So
22.
TSK is the only one that's going to work there.
Yeah,
the
but the
others,
steroid.
the soft fills are just a little.
They pop off.
It's not that they pop off; they bend. And this is going to get viscous. Okay.
Yeah.
So
Okay.
you just kind of want to.
I've done them before.
So we're going to use an 18. Can you get me one of the pinks?
Yep. When you do use a cannula, what size do you go?
Oh,
22?
21 gauge TSK, the long
21,
one.
2 inch?
Is that the long one? So I'm a surgeon, so I'm
So you
metric.
just-
So when anything's
yeah.
in inches, I don't pay attention. I'm a centimeter.
Yeah.
I don't know. It's
Okay.
the longer one. I'm sorry.
Wrapped up in the cord a little.
We're gonna start here, okay? Because her shape is, you're right, I agree, it's
Thanks,
magnificent.
Perfect.
But, and I'm not, please don't think I'm being critical whatsoever.
Yeah, no, it's fine.
The ideal would be have a little more muscle here, okay? So another option here is something like a high intensity focused electromagnetism, okay? So high fem will also
She
work.
also just had a baby and looks like this. Just to.
Okay. 3, 2, stick. You okay?
Mm-hmm.
So you notice, so if you're gonna see a muscle twitch, if you're in the muscle, don't worry, it's gonna twitch.
Yeah.
So I'm deep in here and I'm completely, my needle's right about there. So it's not a bolus, okay? It's a little crosshatch. How you doing?
Good.
Stick. Perfect. Last one. Good. That was me. I didn't have it. I didn't have any lunch today. So you can already see it.
That was. And
Wow.
how much did you start with in that one?
That was just, that's half of one.
Okay.
Wow.
Do you have the other half of this right back there? Do you mind? Sorry to put you to work like that.
No, it's okay.
Perfect.
We like to feel useful.
That's good. Thank you. Back to you. So you're gonna deliver 60 cc's of volume to each side, okay? So if you feel right there, you'll feel that's the firmness you get after a Kaha injection. Stay away from here. You don't want it there.
You know what to sag.
What was the delusion? 3-1?
3 to 1.
3-1.
3, 2, stick. So now here, you wanna get into it. 3, 2, 1.
And you used all sterile water? Or,
Sterile saline.
No, I know.
Perfect. All right.
Wow.
You can see the volume already.
Yeah, let's
Can I get you to stand up? If you feel right here, it's very hard. And as you know, after that gel carrier disappears, that's integrating. So as the gel carrier disappears, it goes like that. Now you're not going to get this, okay? But she's going to get that. That's going to work just fine.
It's a great, like,
Little
side by
nipple?
Oh,
side.
yeah, totally fine.
Good.
Completely fine.
All right. And now for our next trick. Okay, you ready? You ready? You
Oh,
okay
yeah,
to go?
completely fine.
Okay. 3, 2, and stick.
You have it pretty decent.
Oh yeah, you're hired.
And doc, does it stay like that, or is there a little swelling going on?
3, 2, 1. No, so the swelling will go away in about 2-3 hours.
Okay.
And then the next morning when you wake up,
Yep.
you're gonna feel some firmness down here, okay? And then that firmness, as that firmness dissipates, it re-expands.
Wow.
Because it's integrating, causing collagenesis. That's kind of the really exciting part of it, okay? So no matter what, tomorrow when you wake up, you'll think this side's bigger.
Okay.
Because it's about 30 minutes before.
Got it.
That's what's going on. I'm gonna put a little bit because 3, 2, 1. So you're very right-handed, aren't you?
Me?
Yeah.
Yeah, I also had a bunch of knee surgery, so my right side compensates.
I can see it. Yeah.
Amazing.
So now this is another lift zone, right? 3, 2, 1. Sorry.
That lateral.
She doesn't have much here, okay? So there's a little more of a fat component. You're gonna see that because now you're doing a large amount. Stick. You're gonna see stuff like that. Last one. Just a little sweat. So this was the side where she had less concavity, convexity. But you can see that bump is the same. It will continue to expand. Can I get you to stand one last time?
Yes.
And then I promise to put some pants on you.
Thank you.
You're welcome. So now there's more fullness here, fullness here, fullness here. As that integrates, this lifts. As this integrates, this lifts. There's product here, there's product here. That is exactly how it's supposed to look. That's your end point. The end point is really the projection here. Can I borrow your finger?
Yeah.
That firmness that you feel right there is normal.
Okay.
You're gonna feel it for about 10 to 14 days.
Okay.
Yeah, and when it goes away, your butt lifts.
And doc, that was 10 syringes on each side?
Thank you.
Oh, thank you.